Hey guys, it's me again. Welcome to Osium. So, we are going to talk about part 2 of anatomy today, okay? Before diving into part 2, I will explain what all are the important topics we covered in part 1, okay? We are going to see part 1 important topics, okay? At first, we have thoracic wall. In thoracic wall, important thing to you to know in exam is external and internal intercostal muscles, origin, insertion, and very important, direction of the fibers. Okay, please focus on these topics. Plus neurovascular bundle, how it is arranged. It is arranged in van pattern from above downwards. First we will have vein, intercostal arteries, and intercostal nerve. Now next topic will be thoracic nerves. Thoracic nerves, typical and atypical. The differentiation should be absolutely clear here. Okay, so 2 to 6 will be typical, 7 to 11 will be atypical, and first intercostal nerve has what? Brachial plexus relation, and subcostal nerve completely related to abdomen. That you should know for MCQs. Next topic, important topic in thoracic wall will be internal thoracic artery. You should know everything about internal thoracic artery. You should know about the origin, ending, and branches mainly. Okay, let's talk next topic, intercostal arteries. Intercostal arteries, we have anterior intercostal arteries, posterior intercostal arteries. In these arteries, we have to know what are the origins of these arteries, from where it is arising, okay, for you to master the MCQs. Okay, now thoracic veins. In thoracic vein, very important topic will be esophagus. Tributaries, all tributaries of esophagus is important. Origin and what? Termination. Origin and termination is also important. Next one is hemiesophagus. Hemiesophagus means it includes superior hemiesophagus and inferior hemiesophagus. Okay, so what all are the tributaries coming into superior, inferior, you have to know, and this superior and inferior drains to esophagus drains to superior vena cava. Okay, now next topic will be intercostal veins. So we have anterior intercostal veins, posterior intercostal veins. So in right side it is different, left side it's different. So the drainage in right side and left side you have to know. Okay, you should study by comparison. This you should study by comparison. Okay, these all are the topics important for MCQ in thoracic wall. Next topic we have discussed yesterday will be lungs. So in lungs, very important structure is hilum. So structure forming the hilum in right and in left lung. You all know right lung is bigger, it is 3-lobed, left lung is 2-lobed. So what all are the structure present in hilum you have to know. And relations of mediastinum. I told you before itself, in mediastinum we have to know the what? Grooves in mediastinum. What all are the grooves in both right lung and left lung? Which all are structures related to the right lung and left lung? For example, arch of aorta is present in right lung. Arch of esophagus is present in right lung, arch of aorta present in left lung. So that differentiation you should know. Okay, grooves. So after that, important topic will be bronchial arteries. Bronchial artery, I told you, right bronchial artery is only single one right bronchial artery we have, and left we have 2 bronchial arteries, and you have to know about the origins of these arteries. Okay, everything you have to know. Now lymphatic drainage of veins, lymphatic drainage of the lungs is also important. As I said, intrapulmonary lymph nodes will drain to bronchopulmonary lymph node, bronchopulmonary will drain to tracheobronchial lymph node, tracheobronchial lymph node will drain to paratracheal lymph nodes. So that thing you have to know. Next we have 5th topic, bronchopulmonary segments. In these bronchopulmonary segments, they are asking superficial questions. So you have to know right lung has like 10 bronchopulmonary segment, left lung has how many? 8. So these things you have to know. And Superficial reading is enough for bronchopulmonary segments. And very important difference between right lung and left lung. For example, I will not go deep into it, but for example, right lung has like 3 lobes, left lung has how many? 2 lobes. And right bronchus is wider, left bronchus is narrower and longer. Okay, right will be in the same plane of, nearly same plane of what? The trachea. So that thing you have to know, you have to focus. Next, in pleura, we have layers of pleura. We have suprapleural membrane. You have to know the attachment of suprapleural membrane, the apex, everything. And function, okay? Because there was questions yesterday. Nerve supply plus blood supply of pleura. It's simple, okay? I told you, nerve supply, what you have to focus in pleura. We are dividing it into visceral and parietal. So visceral attached to the lung, okay? Visceral attached to the lung means it has same blood supply and nerve supply as the lung, okay? And blood supply also same thing. If it is parietal pleura means away from the pleura. So away means it is related to phrenic nerve and blood supply outside. And nerve supply will be same as phrenic nerve. Now, eighth topic will be pleural cavity and abnormal filling. See, I have told you, if blood is filled in pleura, it means what? Hemothorax. Okay, hemo means blood. If air is filled, it's called pneumothorax. So these kind of short questions comes from pleura. So this was the recap of yesterday's part 1 session. So I hope you guys study thoroughly part 1, and I hope you are getting excellent marks in this module, inshallah. Next, we are starting our part 2. First topic, very important topic, heart. Okay, let's dive into first question of heart. The anterior interventricular artery is accompanied by, I told you, accompanied by anterior interventricular artery. See, anterior cardiac vein, no, wrong answer. Great cardiac vein, yes, we know, we have studied. Anterior interventricular artery accompanies with great cardiac vein. Coronary sinus accompanying with circumflex artery, and middle cardiac vein accompanies with posterior interventricular artery. So focus guys, answer will be B. Okay, next question. Which heart valve has 2 cusps? Easiest question. See, 2 cusps means mitral valve. 3 cusps means, by the name itself, it has what? 3 cusps, tricuspid. Tricuspid in the right side, we all know. Mitral in left side. So answer will be D. Easy answer. Next question. The crista terminalis is a feature of. Okay, crista terminalis is a feature of. We all know crista terminalis is a feature of right atrium. What is crista terminalis? It is muscular ridge between anterior rough called atrium proper and posterior smooth. Okay, it's a muscular ridge between anterior rough and posterior smooth of right atrium. Okay, easy answer guys. Next question, see, it's easy question. Okay, a 42-year-old male was admitted to hospital after a head-on vehicular collision in which he received blunt trauma to his sternum. See, this point is significant here. Blunt trauma to his sternum. So which part of the heart you think it might injure? Anterior or sternocostal surface. Remember, see, sternum, it is injuring the sternum. So sternocostal surface is injured. Let's see what part of the heart would be most likely to be injured by impact. So sternocostal surface majorly formed by what? Right ventricle. See, in sternocostal surface we have right ventricle and left ventricle, but majorly it is formed by what? Right ventricle. Plus atrium is also there, small portion. So mainly it affects which part of the heart? Right ventricle. Okay, it seems quite difficult, but once you hear about sternum blunt entry to the sternum, just think about sternocostal surface. Let's see. Sinoatrial node is situated in. Let's see. It's factual question, guys. It is situated behind the opening of SVC. Behind the opening of SVC. Next, we will see where AV node is situated. Okay, AV node is situated in lower posterior part of interatrial septum. Okay, lower posterior part of interatrial. This is all just the site. Okay, today they asked sinoatrial node. Maybe in exam they can ask AV node. What is the site of AV node? Okay, so we have to be sure. Next, the answer will be C for this question. Next question regarding the heart valves. Regarding the heart valves, choose the correct statement. Please focus on the question carefully. Okay, correct statement they are asking. The aortic valve usually has two semilunar cusps. See, aortic valve has how many cusps? 3 cusps. How many? One anterior, and 2 posterior cusp it has. Okay. Now, pulmonary valve is at the level of third left costal cartilage. Yes, this is the right answer. Okay, third left costal cartilage. Now, the tricuspid valve has anterior, posterior and medial cusps. See, this is the wrong statement. It has what? Anterior, posterior plus not medial. It is called what? Septal cusps. Okay. The ventricular surface of the anterior cusp of mitral valve is rough. No, it should not be rough because blood is passing, guys. Remember, blood is passing, so it should be smooth. The mitral valve lies at the level of 6th costal cartilage. Wrong answer. It lies at the 4th sternocostal junction or costal cartilage. So the right answer will be B. See, we can get more. See, I have discussed 5 options, so we can get any option as a question. Okay, so we are discussing deeply about every option. Now, regarding the left atrium, see, correct statement they are asking. Regarding the left atrium, correct statement. Okay. It forms major part of left border of the heart? No. It forms what? It forms majorly which position? Base of the heart. Yes. It lies behind the right atrium. Yes. It lies behind the right atrium. We all know posteriorly left atrium is present. It has transverse sinus posterior to it. It has no. It lies posterior to the esophagus. No, it lies anterior to the esophagus. So the answer will be B. Let's see. A 45-year-old female was admitted to the hospital with swelling edema of the lower limb. Ultrasound examination revealed incompetent tricuspid valve into which area would regurgitation of the blood. This is what? See, focus tricuspid valve, incompetence and regurgitation. See, think about where is tricuspid valve. See, if this is heart, 4 chambers of the heart, tricuspid valve is present here. So, if this valve is incompetent, regurgitation means what? Backflow of the blood from ventricle to the atrium. So, backflow will occur where? To the right atrium. So, the answer will be C. Okay. Let's move to Next question. On the surface of the chest, apex of the heart is located. See, factual question. I told you, module 104 means very important. What? Site and the positions and like intercostal spaces. These things you have to remember. So, what is the position of the apex? We all know. Fifth intercostal space, mid clavicular line. Okay, fifth intercostal space, mid clavicular line. So the answer will be D. Okay, easy question, guys. Next question, regarding the location of superficial cardiac plexus. See, this is asked in 2025. Easy question. Superficial cardiac plexus. Let's see. In the adventitia of coronary? No. In the concavity of the aortic arch? Yes, it is in the concavity of the aortic arch. I told you, where is deep cardiac plex present? In near the bifurcation of trachea. Near the bifurcation of trachea. See, posterior to the bifurcation of trachea, who is present? Yes, deep. Now, vague arranged in mediastinum? No. So the answer will be B. Let's see next question. Angiogram revealed bleeding from the vein that is accompanied by posterior interventricular artery. Which of the following vein is most likely to be ruptured? See, I told you before itself. Posterior interventricular artery accompanied by which artery? Middle cardiac artery. See, great cardiac artery, we all know which vessel accompanies anterior interventricular. So this will not be the answer. Second option will be the answer. Anterior cardiac vein, no. Small cardiac vein, wrong answer. So the answer will be B. Okay, it's easy. Let's talk about the next question. Which of the following comprises the largest portion of sternocostal surface? See, we have heard same type of question before. I told you, sternocostal surface or the injury to the sternum will cause where? Sternum. Most of the sternocostal surface is comprised by right ventricle. D will be the easy answer. It's easy question. Okay. Which of the following structures open into right atrium? See, if this is heart, we are talking about which all are the structure opening in this right atrium. First, above we have what? Yes, superior vena cava opening, inferior vena cava opening. We have tricuspid valve opening. Plus we have what? Coronary sinus opening. Plus anterior cardiac vein opening. But let's see. In this we have, yes, let's see, focus on option B. 4 pulmonary veins. It opens into, no, it's not right. It is left atrium. Here 4 pulmonary vein opens. Okay. Pulmonary arteries, no. Pulmonary artery opens from right ventricle to the lungs. Okay. From the right ventricle to the lungs, it will carry deoxygenated blood. Okay. So this will not be the answer. This will not be the answer. Ascending aorta, see, ascending aorta is present in which chamber of the heart? You all know, in the left ventricle. So this will not be the answer. So right atrium, the right answer will be coronary sinus. Okay, how to focus on which all are the opening in right atrium, important. Now next question will be which of the following, okay, let's see, regarding the part of conductive system of the heart, select the incorrect answer. Select the incorrect answer. Purkinje fibers, is it conducting? Yes. Sinoatrial node, yes, it is also conductive system. Atrioventricular bundle, yes, but cauda tendini is not conducting. It is what? It is the tendon like insertion for papillary muscles. So C will be the answer. Okay. Let's see the next question. Yes, select the correct statement concerning auscultatory areas of heart valves. Okay, auscultatory areas. Let me be clear about the auscultatory areas. It means In clinical cardiology, where we are auscultating the patient, where we are hearing these valves like perfectly. Let's see. For pulmonary valve, we have left second sternocostal junction or costal cartilage. For aortic valve, we have right second sternocostal junction. Don't confuse. If you hear aorta, you will think about left side, but now we are talking about where we are hearing it, okay, auscultatory area. So it will be right second sternocostal junction. Mitral valve will be in best heard in apex. Apex, I told you before itself, apex means what? Fifth left intercostal space. See, simple. Now, where? Fifth mid clavicular line. So that will be the position of auscultation of the mitral valve at the apex itself. Tricuspid at where? Xiphisternal junction. Easy, right? Let's dive into the options. The pulmonary valve is best heard at second right. Right? Is it right? No, it's left. The aortic valve is heard best at second left sternocostal. No. The mitral valve is heard best at the apex. Yes, it will be the answer. Let's see next D option. The mitral valve lies at the level of left third sternocostal junction. No, it's wrong. Okay, so the answer will be mitral valve C. Let's see next question regarding the right coronary artery, which select the correct statement. Okay, right coronary artery. Let's see. Course through the left auricle and infundibulum. No. Course through what? So this will not be the right answer. Supplies the AV node in 60% of the population. No. It's a wrong answer. It will supply only 20% of the population. Usually has a posterior interventricular branch. Yes. We have posterior interventricular branch. Supplies 30% of SA node. No. Supplies how many percentage of SA node? 60% of SA node. Okay. So remember, let's see branches of right coronary artery. There is a trick for branches of right coronary artery. Will be a right conus PMS. Okay. Conus PMS. What is P? Posterior interventricular artery. M for marginal artery. S for small branches towards right atrium and right ventricle. Okay, since this is right coronary artery. Okay, it's easy, right? So the answer will be C. Next, which of the following structure open into left atrium? See, now we already discussed this before. Let's see. Anterior cardiac vein, no, it is opening in right atrium. Coronary sinus, also right atrium. Superior vena cava, also right atrium. Inferior vena cava, also right atrium. So which is the only option? A, which will open in left atrium. Next question will be, one of the following is correct concerning the coronary sinus of the heart. Let's talk about coronary sinus, which is, they are asking correct option. It is short venous channel about 3 to 4 inches long. See guys, they will confuse you. This is wrong answer. It is not 3 to 4 inches. It is what? 3 to 4 centimeters. Okay, focus. Line to line. It lies in the anterior part of coronary sulcus. No, coronary sinus, guys, we all know coronary sinus is present in the posterior part of the coronary sulcus. So it will be posterior part. It begins as a continuation of middle cardiac vein. No, it begins as a continuation of what? Greater cardiac vein. It ends in the right atrium between the opening of inferior vena cava and right atrioventricular orifice. So this will be the right option. See, Completely clear. Okay, absolutely clear. Now, next question is regarding the cardiac veins. One is true. We have to find out which is true. The greater cardiac vein accompanies posterior descending intraventricular artery. No, this question I have discussed. Greater cardiac vein accompanies anterior. Okay. The middle cardiac vein ends in right atrium. No, middle cardiac vein ends where? In coronary sinus. Okay, this coronary sinus will end in what? Right atrium. Next, the anterior cardiac vein ends in right atrium. Yes, I told you, anterior cardiac vein also ends in right atrium. Obliques veins of the left atrium ends in left atrium. No, see, from the left atrium, it takes the blood. It is a vein, deoxygenated blood from the heart. So, it will drain to same coronary sinus. Okay, this will drain to right atrium. Okay. Now, let's talk a small detail about the tributaries of what? Tributaries of coronary sinus. Tributaries. What all are the veins that is giving the blood to the coronary sinus? Okay. First, it goes like GOMS. Okay. G for greater cardiac vein. O for oblique vein of left atrium. M for middle cardiac vein. S for small cardiac vein. See, if any tributary they ask, you should be absolutely sure. Next, one of the following does not open into right atrium. Let's see. Let's focus. I told you in right atrium we have many. See, this is right atrium. From above, superior vena cava. From below, inferior vena cava. Here, see tricuspid valve where we have atrioventricular orifice. Plus we have what? Coronary orifice. Plus we have anterior cardiac vein. See, anterior cardiac vein, yes. Coronary sinus, yes. Superior vena cava, yes. Azygous vein is wrong, sir. Azygous vein drains blood to where? Superior vena cava, important. Okay. And then it drains to right atrium. So, answer will be, which will does not directly open into right atrium will be azygous vein. Let's see. Posterior interventricular artery is accompanied by, see, posterior interventricular artery. They are talking about posterior. This question, same question. It is accompanied by middle cardiac vein. Okay. So, the direct answer will be let's revise. Great cardiac vein will be what? Anterior interventricular. Coronary sinus, I have told you, circumflex artery, which is a branch of circumflex artery is a branch of what? Left coronary. Okay, it's a continuation or a branch of left coronary artery. Let's talk about the parasympathetic route of superficial cardiac plexus. You know, cardiac plexus involves parasympathetic and sympathetic. So, this parasympathetic route is there, right? So, let's see what it is formed of. It is formed of inferior cervical cardiac branch of left vagus. Okay, inferior you have to focus, left vagus, very important. Okay, factual question but important. Okay, and if they ask sympathetic, so it means sympathetic which route? Superior cervical cardiac branch of left sympathetic chain. Okay, remember, okay, this one, left sympathetic chain, superior cervical. Now, let's move into next question. Blood flows into the coronary arteries arise from blood flows into coronary artery arise from. Let's see. Descending thoracic aorta? No. Coronary artery, where it is originating? Ascending aorta? Yes, I will mention the details. Pulmonary trunk? No. Pulmonary trunk will take the blood from the heart, deoxygenated blood from the heart towards the lung. Okay. Superior vena cava? No. It will take the deoxygenated blood from all over the body towards the heart. Okay. Next, let's see in ascending aorta. Let's see right coronary and left coronary, how it is originating, okay, arising. Right coronary arise from anterior aortic sinus. I have told you ascending aorta or aorta has how many valves? 2 posterior and 1 anterior, okay, 2 posterior and 1 anterior. So anterior aortic sinus, right coronary is originating. Left coronary focus, left posterior aortic sinus. Okay, this detail you have to remember. Okay, left posterior aortic sinus. So the answer will be here. Blood flows into the coronary artery arises from. It is the basic question, ascending aorta. One of the following is not true concerning left atrium. Let's see what is not true. It means we have to find false statement. It forms the main lower part of left border of the heart? No. Who forms main left border of the heart? Left ventricle. Okay. Lies behind the right atrium? Yes. It has oblique sinus posterior to it? Yes. It lies anterior to the esophagus? Yes. So which one is the false statement? A. Simple. Yes. Next we are talking about concerning the left ventricle. Concerning left ventricle, select the incorrect statement. See, now also we have to find out false statement. Okay. It is 3 times thicker than the right ventricle. Yes, we all know. We want oxygenated blood all over the body. So the pumping power should be more. So it is 3 times thicker than a right ventricle. The trabeculae carni are more than those of right ventricle. Yes, it is more than that of, because should be thicker, right? So trabeculae carni is also more than right ventricle. It contains anterior, posterior and septal papillary. No. It has how many cusps? See, 2 cusps means mitral valve. Left side has 2 cusps, mitral valve. So it only has 2 papillary muscles, anterior and posterior papillary muscles. That's it. So we don't have septal papillary. Septal papillary muscle is present in which side? Right side, means tricuspid valve. Yes, you are right. The left coronary artery supplies a major part of interventricular artery. Yes, this is also right. How much? 2/3 of the interventricular septum. Okay. So the wrong statement, so the incorrect statement will be C. Let's see regarding heart. Regarding the heart, mark correct statement. Correct statement. It lies, its apex lies 4th left intercostal space. No. It lies how much? 5th left intercostal space, mid-clavicular line. Okay. Focus. The mitral valve lies behind 3rd left. No. Mitral valve lies at 4th costal cartilage. The left coronary artery supplies the sinoatrial node. Left coronary artery supplies the sinoatrial node. How much? 60%. No. Left will supply only 40%. Remember, the sinoatrial node is located near the entrance of superior vena cava into right atrium. See, D will be the answer. This is the location of sinoatrial node. Okay. Let's see the next question. Regarding coronary arteries, choose a wrong answer. See, false statement. Every time in exam, focus to read question so that you don't miss, okay, by mistake. You have to point out the false statement here. The left coronary artery arises from the left posterior aortic sinus. Yes, I have mentioned now. Okay, it is formed from left posterior aortic sinus. Right coronary dominance occurs in 75% of people. Yes, right coronary dominance happens in 75% of the people. AV node usually receives arterial supply from the left coronary artery. No, from, yes, AV node mainly receives arterial from right. How many? 80%. Okay, in textbook it is written, guys. The anterior interventricular artery is the branch of left coronary. Yes, this is also true. So the wrong statement will be C. Okay, it's clear? Yes. Now concerning the base of the heart, choose incorrect statement. Okay, let's see. It is formed by atria. Yes. See, base of the heart, I told you it is mainly formed by atria. Two atrias. In that also mainly whom? Left atrium. Both atrium plus mainly left atrium. Its upper border is related to pulmonary arteries. It is related to, yes, pulmonary arteries. Now, the right coronary and circumflex artery lies between the base and the diaphragmatic surface. Yes, right coronary and circumflex artery lies between the base and the diaphragmatic surface. Yes, it's a true statement. We have to find the incorrect statement. It lies opposite to the middle 8 thoracic vertebra. No, it lies, yes, middle 4 thoracic vertebra. Okay, middle 4 only. So this will be the false statement. Option D. Which vertebras? 5th to 8th. Okay. Now, regarding next question. Regarding the right ventricle, one of the statement is wrong. See, it contains 3 papillary muscle. We all know right side means tricuspid. Tricuspid means 3 valves, 3 papillary muscles. Okay. The chordae tendineae of anterior papillary muscle are attached only to the anterior cusp. No. See how it is attached. Let's see. Anterior papillary muscles attached to the anterior cusp plus posterior cusps. See, focus here. Posterior papillary muscle attached to posterior plus septal. Okay, alternatively, see. Now, septal papillary muscle attached to septal plus anterior. This you have to remember this topic. Okay, so the wrong statement will be B. Let's see next option. The moderator band extends from the base of the anterior papillary to the interventricular septum. Yes, this is actually the definition of what? Definition of moderator band. Okay, this is true. The chordae tendineae of each papillary muscles are attached to 2 cusps of the tricuspid valve. Yes, I told you, see how it is attaching by this way. Okay, so this is also true. So wrong answer will be B. The pulmonary valve sound is best heard. See, I have told you the trick how you are find outing PAMPed. Just in exam you write PAMPed. Okay, pulmonary at which level? I told you left second sternocostal junction or costal cartilage. Okay, aortic right second sternocostal cartilage. Best heard means auscultatory areas. Okay, now mitral valve at the apex. Apex means 5th left intercostal space, mid clavicular line. Okay, now tricuspid at xiphisternal junction. Okay, so the answer will be second left intercostal space. Okay, now choose the wrong answer regarding anatomy of the heart. Wrong answer we have to find out. The sternocostal surface is formed mainly by right ventricle. Yes, I told you this concept. Sternocostal mainly by right ventricle. The base is formed mainly by the left atrium. Mainly by the base. Yes, base is formed mainly by the left atrium. The apex is formed by both ventricle. This statement is absolutely wrong. Why? Because apex is only formed by left ventricle. Okay, apex means outermost downwards, where we can what? Hear the mitral valve. Yes. So this is the wrong statement. Left ventricle wall is usually 3 times thicker than that of right ventricle. Yes, it is also true. So the right answer is C. Let's see. The apex of the heart normally located at, see, this is also a repeated question, see, at, I told you, 5th left intercostal space. This question I have put because, see here in centimeters they are catching you, okay. So it is 9 centimeter, or we can write it is 3.5 or 3.5 inch, okay. So C will be the answer. Left 5th intercostal space, 9 centimeter from the midline. Okay. In centimeter, please focus because it's one of the most important question. Apex, and most important clinically also. So regarding left coronary, which is the incorrect statement. It arises from the left posterior aortic sinus. See, left coronary, I told you left posterior. Yes, it's true. It passes forward between the aorta and pulmonary trunk. No, it is not passing forward between the aorta. It passes forward in between left auricle and pulmonary trunk. This is in the course of left. If you focus on the course of left coronary artery, you can know. Okay, so B will be there. Let's see other options. It ends by anastomosing with the right coronary artery. Yes, it ends by the anastomosis. Posterior side of the heart, we have anastomosis with left coronary and right coronary artery. It gives off anterior interventricular artery. Yes, it is giving anterior. Who gives posterior? Posterior interventricular artery given by right coronary. Anterior left coronary. So it's the right answer. So regarding left coronary, which is incorrect, incorrect will be option B. So heart is situated in, simple and easy question, heart is situated in middle mediastinum. Superior wrong, anterior wrong, posterior wrong. So in middle mediastinum, heart and pericardium together with heart. It is in middle mediastinum. Next question. One of the following structure is not related to right ventricle. Let's see. Papillary muscles. Yes, right ventricle has how many papillary muscles? 3 sets of papillary muscles. Anterior, posterior, septal. Moderator band. Yes, it has septomarginal moderator band. Fossa ovalis. No, fossa ovalis is present where? Right atrium. Chorda tendini, yes, it supports the papillary muscle. So the option incorrect is fossa ovalis. Regarding the anatomy of the heart, let's see which is wrong statement. Okay, the sternocostal or anterior surface of the heart is formed mainly by right ventricle. Yes. The heart rests on inferior surface. Yes, heart is resting, or the base, or no, sorry, or the diaphragmatic surface or the inferior surface. It is resting, right? Yes. The left ventricle lies anterior to the right ventricle. Left ventricle lies anterior. No. Who is most anterior? Right ventricular. Right ventricle is most anterior. Okay. So this is the wrong answer. The left ventricle wall is usually 3 times thicker. Yes, it is thicker. So the wrong statement will be option C. Okay. Regarding the interventricular septum, let's see. One of the following statement is incorrect. See, false statement we have to identify. Its right surface is directed anteriorly. Its right surface is directly anteriorly to the right. Yes, interventricular septum. See, if I draw the cut section, I am cutting the heart like this, and we are viewing from the upper side. It will be like this. See, interventricular septum continues with the left ventricle. So, see, it is convex towards the right ventricle. Okay, it's convex towards, not left ventricle. It's towards right ventricle. See, this is right, it's left. Okay, concave towards left. So it's let's see option number C. Its anterior border corresponds to the anterior interventricular groove. See, this groove is called what? Anterior interventricular groove. So this is right. It is formed of a membranous and muscular part. Yes, we have told before. This is heart. If this is what? Interventricular. First starting with membranous layer, and then we have thick what? This much is membrane, this much is what? Muscular part. See, so it is formed of membranous and muscular part. Okay, it's clear. The option is B. Regarding heart, choose correct answer. Okay, it lies in the middle mediastinum. Easiest question ever. See, yes, it's true. Its base is formed of mainly both atrium. Mainly right? No, it's mainly left atrium. See, that is the wrong answer here. Its apex is formed by both ventricle. No, it's only formed by left ventricle only. Okay, atrium mainly. Now, its right atrium receives 4 pulmonary veins. No. Who receives 4 pulmonary veins? 4 pulmonary veins received by left atrium. Okay, the option will be, the correct option will be, it lies in the middle mediastinum. Let's talk next question. The inferior vena cava brings blood. Easy question, okay guys. Blood from the lower region of the body and empties into. I have told you before. It will carry what? It will carry deoxygenated blood from the lower body, and it will drain to what? Right atrium. Simple answer. Option A. Now next question. The atrioventricular groove. Atrioventricular groove of the heart lodges on following vessels. See, this is heart again. Okay, they are talking about this groove. This groove, atrioventricular, this groove. Okay, we know in the course of coronary arteries. See, right coronary artery is passing through anterior part of coronary sulcus. Okay, anterior part of coronary sulcus. So this will be what? Yes, this will be the answer. Okay, anterior part of, like this. From, see, if ascending, this is the aorta. Let's see, this is aorta, and from here it's going from the anterior septum. Who is giving blood supply? From here, yes, right coronary artery arises and passes through the AV, this ventricular or coronary sulcus. It is called atrioventricular sulcus or coronary sulcus. AV sulcus also it is called. Okay, so the right answer will be C. Now, regarding pericardium, true statement. Okay, the strong sternopericardial ligament connects fibrous pericardium to the sternum. Yes, this is the true statement. We all know this sternopericardial ligament. Another question related to it. See, sternopericardial ligament is present in which mediastinum? If they ask, it is present in superior mediastinum. Okay, let's see next options. The superior vena cava does not fuse with the fibrous pericardium. No, it fuses. Superior vena cava, it fuses with the parietal layer of serous pericardium has no nerve supply. Wrong answer. It has nerve supply, which will be phrenic nerve. Okay, mostly phrenic nerve. Now, the transverse sinus separates the 4 pulmonary veins. No, transverse sinus will not separate. Who separates? Oblique sinus will separate. If you see the differentiation between oblique and transverse sinus, you might know. So the answer will be A. Okay. Now, regarding the transverse sinus of the pericardium, which one of the following statement is incorrect? See, incorrect. Focus. It is a passage between arterial and venous end. Yes, transverse pericardium. How we are knowing it is transverse pericardium? We insert a hand, or how we are getting towards the transverse sinus? We insert a index finger in between pulmonary trunk and aortic end. So it is the passage between arterial and venous end of the heart. It is bounded in front by ascending aorta and pulmonary trunk. Yes, see the same thing I have told. It is bounded above and behind by left pulmonary artery. No, wrong answer. It is bounded below and behind by the superior vena cava and true atria. Yes, it is also true. Let's see. So the answer is C, which will be false statement. But let's see about the relations of transverse sinus. So anteriorly we have what? Ascending aorta, anteriorly and ascending aorta, and what we have? Pulmonary trunk. Above and behind together we have a right pulmonary artery. Okay, right pulmonary artery. Below and behind we have superior vena cava and two atria. Okay, mainly left, mainly. So the answer will be C. This you have to memorize. Next question is regarding the oblique sinus of pericardium. One of the following statement is incorrect. Okay, false statement we have to find out. It is a blind recess between right atrium and fibrous pericardium. No, it's a blind recess between left atrium and fibrous pericardium. Below the sinus is open into the main pericardial cavity. Yes, it is opening into. The entrance of the sinus is bounded by IVC and lower left pulmonary vein. Yes, it is also bounded by lower left pulmonary vein and IVC entrance. The left atrium separates it from transverse sinus. Yes, it is true. So the wrong statement will be A. Okay, you have to see the boundaries of oblique sinus. Okay. Now, next question regarding the function of pericardium. One of the following statement is incorrect. See, also we have to find false statement. Fibrous pericardium protects the heart. Yes, it's true. Fibrous means tense, so it should protect the heart. The oblique sinus act as a bursa behind the left ventricle. No, wrong answer. Behind the left atrium. The oblique sinus allows expansion of the esophagus during swallowing. Yes. What extra function it has? It allows the expansion of esophagus during swallowing, and it allows what? Descending aorta pulsation. Okay. Next, the transverse sinus allow the distension of ascending aorta. Distension of ascending aorta. Yes, it's true. And also it has what? Distension of pulmonary trunk also. Add this because tomorrow in exam they can ask about these things. Okay. So the wrong statement will be sorry. Yes. So this is the right statement. A wrong statement will be B. Okay. Next, regarding the pericardium of the heart, indicate a wrong answer. Again, wrong answer. Fibrous pericardium is attached to the central tendon of the diaphragm. Yes, fibrous pericardium means base of the heart. Yes, it is a true statement. Okay. The fibrous pericardium is attached to the sternum interiorly. Yes. where the anterior surface of the pericardium, okay, anterior surface of the pericardium is attached to what? Attached to the sternum by sternopericardial ligament. Okay, don't forget. The parietal pericardium is supplied by phrenic nerve. Yes, parietal I told you outside, so it is somatic nerve. So which is the somatic nerve? Phrenic nerve. Yes. Fibrous pericardium lines the serous pericardium. No, it does not line. So the D will be a wrong statement. Okay. Now, regarding fibrous pericardium, it is innervated by, see, simple question. Just think about fibrous pericardium has same nerve supply like parietal. Parietal pericardium means I have told you phrenic nerve. See how I got this answer? So the answer will be C. Let's now, we finished guys, finish the whole heart with pericardium. Okay, I have managed to explain the concept itself together, okay, so that you don't miss any concept. Okay, let's start with large vessels and nerves and tubes of thorax. Okay, first question. One of the following branch of descending thoracic aorta. Left bronchial artery? Yes, it is. It is the branch of descending thoracic aorta. Let's see next questions. Right subclavian artery? No. Right subclavian artery is what? Branch of brachiocephalic artery. Remember, you only in the right side, we only have one brachiocephalic artery, which will give what? Right subclavian and right, this one, right common carotid. Okay, so this is what? Wrong answer. Left subclavian from which? From arch of aorta directly. You know, right? Arch of aorta means first branch brachiocephalic artery. This will give common carotid to the up and subclavian, common carotid to up and subclavian to the upper limb. Okay, right one, right. So this is a right common carotid, direct, sorry, the left common carotid, So it is directly from the arch of aorta, and then we have what? Left subclavian. So right common carotid arises from brachiocephalic artery. So the branch of descending thoracic aorta only present here is left bronchial artery. Okay. Now regarding the descending thoracic aorta, okay, regarding descending thoracic, which one is correct? Let's see. It passes through the diaphragm to abdomen at the level of T7. Wrong. Which? At the T12 lower border. Okay, T12. It is a component of middle mediastinum. No, it is a component of posterior mediastinum. In mediastinum component I have explained. Okay, contents of mediastinum very important. Okay, begins at the level of T3. No, where it begins? At the sternal angle, or we can say disc between what? T4 and T5. This location is very important. Star mark. It begins at start of arch of aorta. Yes, this one will be the right answer. See, A, B, C wrong, plus descending thoracic aorta, it begins as the start of, you all know, see, from the ascending aorta, this is ascending aorta, this much, arch of aorta, and then starts who? Descending aorta. So what? It begins from the start of the arch of aorta. Starting from the, okay. Let's see next option, next question. Which of the following is related to the arch of aorta on its right side? Okay, Let's see on the right side what all we have. Arch of aorta, right, and we can also say it's posterior right. Okay, so it has thoracic duct, plus it has trachea. Near trachea, we all know which plexus we have. Yes, deep cardiac plexus. And also, if there is trachea, there should be esophagus. Okay, esophagus. Yes, in between trachea and esophagus, there is one nerve sandwiched. That is very important. Left recurrent laryngeal. Let's see in these option. Let's see in these concept we have this option or no. Left phrenic nerve, no. Right phrenic nerve, no. Left recurrent laryngeal nerve, yes. C will be the answer. Right recurrent, no. So the answer, you have to know the relations of arch of aorta to solve this question. Okay, C will be the answer. One of the following branches not arising from descending thoracic aorta. Let's see. Let's talk about branches of descending thoracic aorta. Okay, how many branches it gives? First, 9 pairs. It gives 9 pairs of posterior intercostal artery. From where to where? Okay, and it also gives pairs of subcostal. Okay, 9 pairs means 3rd to 11th. Okay, 3, 4, 5, 6, 7, 8, 9, 10, 11. Yes, 9 pairs. Now, 2 left bronchial artery it gives, plus 4 to 5 esophageal branches it gives, and some pericardial, some mediastinal, and some diaphragmatic. So mainly you have to know about 9 pairs of subcostal, 2 left bronchial, very very important, and 4 to 5 esophageal branches. So let's see in option. Posterior intercostal artery, no. Subcostal artery, yes. Left subclavian, no. Left bronchial artery, yes. So here, okay, they are talking, sorry. Here this is not wrong answer. This is right answer because I told you posterior intercostal artery, it is, yes, sorry. Okay. So they are talking about a wrong statement. So the wrong statement only present here is C, left subclavian. Where it is coming from? Left subclavian, directly from the arch of aorta. Okay. Clear? Yes. Next question. Let's talk about arch of aorta. Very important. Arch of aorta. It begins at the disc between T4 and T5. It begins at the disc between T4 and T5. No. It begins at right second sternocostal junction. Okay. It lies in front and left of the bifurcation of trachea. Yes, arch of aorta. See, I told you arch of aorta relation. In there, we studied right and posterior. Who was there? Trachea. So, in passive voice, see, this answer is in passive voice. That's it. Has the superficial cardiac on its upper convex border? No. The lower concave. Okay. Has right recurrent nerve passing below? No. Left recurrent. Okay. This is also same question from the relation of arch of aorta. Arch of aorta. Okay. Let's see concerning concerning descending thoracic aorta. Choose the correct statement. Okay. It begins at the level of sternal angle. Yes, it begins. Origin of descending thoracic aorta is at sternal angle, which is disc between T4 and T5. It ends at the lower border of 10th vertebra, 10th thoracic vertebra. Yes. No, 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 no. Sorry, sorry, sorry. It is wrong answer. No. Correct statement. So A will be the answer. Let's see other option. It ends at the lower. No. It ends at T12. T12 means it ends at the aortic opening. And it continues as what? Abdominal aorta. Okay. From the thorax, it has name what? Descending thoracic aorta. If it gets in abdomen, it's called abdominal aorta. You will study it in second year. Now, it is related anteriorly to hemiazygous vein. No, it is not related. It related posteriorly to hemiazygous. It gives gastric branch. No. So the answer will be A. Okay. Next question. Which one of the following regarding superior vena cava is not true? Okay, false. It is formed behind first costal cartilage close to manubrium sterni. Yes, it's true. Opens into the, this is origin, okay, origin of SVC. It opens into the right atrium behind the right third costal cartilage. Yes, opens means it ending, yes, it's true. Now receives hemiazygous vein. No, who receives hemiazygous vein? Hemiazygous vein drains to azygous first. It drains to azygous vein first. So this will be the answer. This azygous will drain to superior vena cava. Okay. Lies in the superior mediastinum. Yes, absolutely right. Okay. By the name itself, we have superior vena cava in the superior mediastinum. Okay. So next question. Union of two brachiocephalic vein to form superior vena cava occurs behind following level. Let's see. Let's see what they meant. Means they meant origin of superior vena cava. If you know the origin location, it's easy. Okay. So it will be first right costal cartilage. Simple answer. Guys, large vessel, you need to know the origin and termination. What is the location? See, I have mentioned it before itself. Every origin and ending, you have to know about the site and what and how question. Okay. From what it is coming. First thing, first question. And maybe it comes as a continuation or no. Okay. Anatomy, you have to know continuation or it is union or it is a terminal branch, you should know. Okay. That's main thing you should know in origin and ending. Every vessel, every nerve, these thing applies in anatomy. Okay. Next question regarding arch of aorta. Select false statement. Okay. Arch of aorta, select false statement. Located in superior mediastinum. Yes, it's the right statement, true statement. The right brachiocephalic vein runs along its upper border. No, which brachiocephalic vein? Left brachiocephalic vein runs. Okay, so this is the right answer. Let's see next option. Its lower aspect is related to left primary principal bronchus. Yes, it is related to left principal bronchus. I have told you, arch of aorta, arch in front of the left or hooks in front of left primary bronchus. Okay, it's left, it's option D, its left anterior aspect is related to left phrenic and left vagus nerve. Yes, it's true. Absolutely, sorry. So the correct answer will be B. Okay. Regarding descending thoracic aorta. Regarding descending thoracic aorta, select true statement. Let's see. It's related posteriorly to trachea, esophagus with left recurrent laryngeal nerve in between. Is it? They are talking about true statement. No, it is not. Posteriorly, who we have? In descending thoracic aorta, posterior relation we have lower 5 thoracic vertebra plus we have vertebra, this is vertebra, plus we have superior and inferior hemiazygous vein. Okay, hemiazygous vein posteriorly. So this is the wrong answer. Now, it ends at the lower border of T10. No, I have told you where it ends at the abdominal opening. Sorry, aortic opening. So, aortic opening at T12. It is related anteriorly to the heart, pericardium and diaphragm. Yes, anterior relation is heart, pericardium and diaphragm. Okay, and lower end with esophagus also. Anteriorly, esophagus is also anteriorly present. It gives right upper 9 intercostal artery. No, it is not upper. See, here you can be confused. Please don't confuse yourself. See, upper, it is not upper, it is what? Lower 9. So I told you which branches? 3rd to 11th. 9 pair. Okay, 3rd to 11th. So the true statement will be C. One of the following structure lie below the aortic arch. Let's see which lie below. See, below the aortic arch. What all we have? Let's see. Bifurcation below relation of or inferior relation of arch of aorta. Bifurcation of pulmonary artery. We also have ligamentum arteriosum, plus we have superficial cardiac plexus and left recurrent laryngeal plus left principal bronchus. See guys, left principal. Let's see. Left brachiocephalic vein. No. Brachiocephalic artery. No. Left common carotid artery. No. Left principal bronchus, which is present below of arch of aorta. Just think. See, even if you don't know this relation, just think about arch of aorta. I have told you arch of aorta. If left principal bronchus is like this, arch of aorta is like hooking, like this. Hooking. So hooking means it will be present below, right? Below. Okay. So left principal bronchus is below the arch of aorta. Next question. Question number. Okay. The superior vena cava, choose true answer. We have to choose true answer. Has only one tributary, terminate its posterior surface at level of first left costal cartilage? No. First right. Okay. It is formed behind the manubrium sterni. No, it is not exactly behind the manubrium sterni. It is close to. If you have thoroughly read the textbook, you will have noticed close to the sternum. Okay. Opens into right atrium behind the third right costal cartilage. Yes, this is the location of ending of what? Superior vena cava. See, again and again. It lies in the posterior mediastinum. See, superior vena cava lies where? In the superior mediastinum mainly. Okay. So the answer will be C. And again, here the part, see, they are talking about, okay, the part which has, see, if this is right atrium, okay, see, this is heart. From here there is superior vena cava, right? These part of superior vena cava in superior mediastinum, the one embedded in right atrium, it will be in middle mediastinum. Okay, just like common sense, think about. Okay, next question. Regarding the arch of aorta, one is false statement. Okay, let's see. It commences at the level of sternal angle. Yes, it's true. It commences at the level of sternal angle. Now, the esophagus lies anterior and to the left. Esophagus lies anterior and to the left. No, it's the wrong statement. Esophagus lies where? Esophagus in posterior and right? And left vagus nerve lies anterior. Yes, it's true. The trachea lies posterior and to the right. Trachea lies posterior and to the right. Yes. So we have what? Correct answer, which is false, is B. Okay. One of the following veins drain into the right brachiocephalic vein. Let's see. Okay. See, we have a right brachiocephalic and left brachiocephalic. This will form superior vena cava. Okay. So right brachiocephalic, let's see. Azygous vein, it drains blood to directly to what? SVC. This will not be the answer. Thoracic duct, we all know thoracic duct drain to left brachiocephalic vein. Okay. And right lymphatic duct will drain to right side, will drain to right brachiocephalic. So see, this one will be the answer. Let's see. Superior hemiazygous. Superior hemiazygous, inferior hemiazygous, as I told you, it will drain directly to azygous. Okay. So the right answer will be C. Let's see regarding arch of aorta. It's a very important question. Okay. Important question. Arch of aorta. Select the correct statement. Okay. It ends in the lower border of T6. No. It's wrong answer. It ends where? Ends in the disc between, also here. Disc between T4 and T5. Okay. You have to, guys, from textbook itself, you have to know the origin and ending of, see, every great or large vessel, you need to know the origin and ending. Okay. Please focus. And the left superior intercostal vein crosses superficial to the arch. Yes, this is the correct statement. Let's see next questions. It is connected to the right pulmonary artery by ligamentum arteriosum. Which pulmonary artery? Not right. It will be left pulmonary artery. Okay. Ligamentum arteriosum means what? It was ductus arteriosum when we are fetal. Okay. But after that it get closed and it becomes ligament. But it is attached from where to where? From arch of aorta to left pulmonary artery. Okay. It begins opposite the fourth sternocostal junction. No, it begins at second sternocostal junction. See, it's the beginning, it's the ending. Okay. So the answer will be B. Concerning thorax, choose a wrong answer. Okay. Let's see. The left recurrent laryngeal nerve curve around the arch of aorta medial to the ligamentum arteriosum. Yes, it's a true statement. If you know the route and course of left recurrent laryngeal nerve or the left vagus, it's easy. The deep cardiac plexus lies near the bifurcation. See, it's true statement. The thoracic duct crosses behind the esophagus opposite to T5. Yes, thoracic duct passes behind the esophagus through esophageal opening. This is the wrong answer. Which opening? Guys, thoracic duct will be in aortic opening. We have azygous vein, we have thoracic duct, we have what? Descending thoracic aorta. So at which level? T12. Okay. This level is also important. What all are the contents passing through is also very important. Okay. So the answer will be D. Now, one of the following structure is not present in the level of sternal angle. See, I have told you multiple times, sternal angle level is very, very important. Let's see. The second rib articulates with, see, if think that this is what? Sternum. Okay, so this is sternal angle. First, second rib, see, second rib will be where? Attached at the angle of sternocostal. So second rib articulates with the sternum at the sternal angle. Yes, this is second rib. Okay. Now the trachea bifurcates at, yes, at the angle sternocostal or at disc between T4 T5. Now the termination of arch of aorta, is it? Yes, it's true. The beginning of superior vena cava, it is false. Where superior vena cava beginning, I told you, union at third, sorry, first right costal cartilage. Okay, aortic arch begins, yes, this is also true. So sternal angle, see, memorize all these criteria where sternal angle position is there. Okay, so the correct answer which is not present at the sternal angle will be beginning of superior vena cava. By exclusion also you can choose these options. Okay, regarding descending thoracic aorta, mark wrong answer. Okay, let's see. It gives posterior intercostal artery lower 9 intercostal spaces. Yes, lower 9 pairs, I told you. Yes, it's true. It is about 8 inches. No, yes, it is about 8 inches. It's true. It descends on the left side of bodies of 5 to 7 thoracic vertebra. Yes, it's also true. Okay. Now, its lower part is related to quadrate lobe of the liver. No, it's false answer. Okay. Descending thoracic aorta relation. Now, indicate the incorrect option in this. Okay, incorrect option of ascending aorta. It begins at the level of third intercostal space behind the left border of the sternum. Yes, third. Okay. The right coronary artery arises from its anterior aortic sinus. Yes, I told you, right coronary means anterior aortic sinus. Left coronary means, again revision, okay guys. Left coronary means, yes, you are right, left posterior aortic sinus. Focus here because posteriorly we have two cusps or two sinuses. Okay, it lies within the pericardial cavity. Yes, within the pericardial cavity. So if it is within the pericardial cavity, it should be in which mediastinum? Should be in middle mediastinum. See, middle mediastinum. So the fourth option is wrong. It is not in superior mediastinum. So wrong answer they ask, option will be D. Let's see. One of the following structure passing between arch of aorta and pulmonary trunk. See guys, you have multiple questions from arch of aorta and descending thoracic aorta. It means that topic, large vessels, it is most important topic. Okay, heart and large vessels are most important. Thoroughly read textbook and try to focus on the questions I am dealing with the concept. Okay, one of the following structure passing between arch of aorta and pulmonary trunk. Let's see, arch of aorta and pulmonary trunk. Ligamentum arteriosum, yes, it is passing. Superficial cardiac plexus, yes, it is also passing. Left recurrent laryngeal nerve, I have told, yes, it is also passing. So the answer will be all of the above. Now, regarding descending thoracic aorta, choose wrong statement, means false statement. Okay, it descends in the middle mediastinum. See, descending thoracic aorta, first itself it is wrong. What? It descends in posterior mediastinum. Everyone knows. Okay, it gives posterior intercostal arteries to lower 9 intercostal spaces. Yes, it's true. It begins at the level of intervertebral disc between T4 and T5. Yes, it's true. Means sternal angle. It enters to the aortic opening of the diaphragm at T12. Yes, it is also true. The wrong statement will be A. Let's talk about arch of aorta. One of the following statement is incorrect. It begins at second right sternocostal junction. Yes, true. The right brachiocephalic vein runs along its upper border. No. Which brachiocephalic vein? Again question. Repeated question. Left brachiocephalic vein. Its lower aspect is related to left principal bronchus. I have told you before itself. It arches. See, it arches towards. It arches or hooks above left bronchus. So if this is the arch, below who is there? Left bronchus. See, so this will be the right answer. Its left anterior aspect is related to left phrenic and left vagus. Yes, this is also true. So the wrong statement will be B. Regarding brachiocephalic vein, one of the following statement is incorrect. Let's see. Regarding brachiocephalic vein, one of the statement is incorrect. False statement. Okay. They drain both upper limb and head. See, by the name itself, brachio means what? Brachio means upper limb. Cephalic refer to head. Cephalic means head. So upper limb and head. See, this is the right answer. Incorrect they are asking. They drain lymph from whole of the body. Yes, we know. Mainly right side, who is responsible? Right lymphatic duct. Left side thoracic duct. Okay. They are talking generally about brachiocephalic duct. So right will give to right brachiocephalic vein. Thoracic duct will give to left brachiocephalic vein. So in general, it is going to brachiocephalic vein itself. So this statement is whole body lymph is giving lymph to brachiocephalic veins. Yes, this is true. They unite together to form superior vena cava. Yes, this also I have explained. Yes, this is true statement. They end behind lower border of third right costal cartilage. Wrong. They end at the origin of SVC. Origin of SVC means this is origin of SVC. See, anatomy is very easy. If you know the correlation, it is very easy. See, ending of brachiocephalic vein is the same origin of what? Superior vena cava. See, if this way you study anatomy, anatomy is like piece of cake. Okay. Okay. Regarding superior vena cava, one of the statement is incorrect. Let's see. It drains upper half of the body. Yes, it is true. Okay, upper half of the body. Its lower half lies inside the fibrous pericardium. Yes, this is also true. It pierces the fibrous pericardium at the level of third right costal cartilage. No, here you have to focus. It pierces at which level? See, origin at first right costal cartilage, pierces at second right costal cartilage, ends at third right costal cartilage. See, so the pierces they are asking, this is not third, don't confuse here. Okay, so this is wrong answer. It has only one tributary. Yes, which is the one only tributary? Esophagus vein. I told you, esophagus vein drains to superior vena cava at right third costal cartilage. That also. Okay, third right costal cartilage. See, so the incorrect option will be C. One of the following branches arises from ascending aorta. Simple and easy question, guys. Just think about it. Subcostal artery, where it is arising from? Arising from descending thoracic aorta. Right subclavian artery, see, arising from brachiocephalic artery. Brachiocephalic artery from arch of aorta. I have told you, this is brachiocephalic, common carotid, subclavian. Brachiocephalic artery, left common carotid, left subclavian. Okay. So right common carotid artery, see, right common carotid artery from, yes, brachiocephalic artery. So the only option without, see, exclusion I am solving, right coronary artery. By knowledge, how you will say, if this is ascending aorta, yes, right coronary and left coronary. I have mentioned the origin again and again. Okay, right from anterior aortic sinus, left from left posterior aortic sinus. Now, the right phrenic nerve, okay, we'll talk about right phrenic nerve. What is the, so it is the sole motor supply of right hemidiaphragm and crus. Yes, this is a true statement. Let's see other statements. Gives recurrent laryngeal nerve. No. Who gives recurrent laryngeal nerve? Vagus. Okay, vagus. Has, this should be has no sensory component. No, it has some sensory. Okay, it originates from T3. No, don't confuse here. It originates from C3, C4, C5. Okay, this is also wrong answer. So the right answer will be A. Let's see case type of question, but this is absolutely easy question, guys. A 42-year-old woman was admitted to the hospital with an inability to speak. See, inability to speak means it is related to larynx. Okay. The patient's personal history revealed she had experienced hoarseness of voice. See, she also has problem in the voice. See, that is also a clue there. Okay. For the past month, a chest radiograph revealed mass at the region of ligamentum arteriosum. See, again clue. Which of the following nerve was the most likely compressed? See, let's see. Phrenic nerve, not at all possible. It is not related to the larynx. Left recurrent laryngeal nerve, yes. It is the only nerve that will pass through the ligamentum arteriosum and related to larynx. So the answer will be B. Let's see. Right recurrent laryngeal, no. Greater thoracic splanchnic, every other things, wrong answer. So the only nerve which is compressed and it is producing what? Hoarseness of voice will be left recurrent laryngeal. Very, very important question. Okay, anyhow they make it twist and ask him. Okay, ask in the exam. The left laryngeal nerve hooks inferiorly around. See, it hooks inferiorly around what? Arch of aorta. Easiest question. Okay, this is arch of aorta. Left recurrent laryngeal nerves comes from left vagus and it hooks around what? Arch of aorta and goes in between two tubes. What? Trachea and esophagus. Okay. Now, following structure is not supplied by left phrenic nerve. Okay, which is not supplied? Diaphragm. By the name phrenic itself, you should know it should supply diaphragm. Okay, and mediastinal pleura. Yes, I have told you. Pleura has how many layers? Parietal and visceral. So this parietal pleura is supplied right by phrenic nerve. Yes. Visceral pleura has same blood supply as lung. So whatever lung has nerve supply, visceral pleura has. Now parietal pericardium, yes, also supplied by phrenic nerve, but the wrong option will be D, left ventricle. Okay, left ventricle. Ventricle means heart. Heart is not supplied by what? Somatic nerve. Heart is supplied by autonomic nerve, means superficial and deep cardiac plexus will be responsible. Deep and superficial cardiac formed by parasympathetic vagus. You have to know the roots, and sympathetic chain. Sympathetic is chain. Okay. Okay. Now, one of the following regarding the vagus nerve is true. Okay, vagus nerve is true. Let's see which is true. The left vagus forms posterior esophageal plexus. No, left vagus always forms. This topic is important, guys. They can confuse you. Okay, left. Okay, let's start with right vagus will form posterior esophageal plexus. Okay, left vagus always forms anterior esophageal plexus. So this is not true. Left vagus along the whole course of its course in the superior mediastinum, it relates laterally to left lung. Okay, it should be left lung. Yes, this is true. Okay, Each vagus terminates by formation of anterior pulmonary plexus. No. See, I have mentioned. The right vagus forms the anterior esophageal plexus. Right vagus forms the anterior. No. See, right vagus forms posterior. In this simple concept, you have got this question. Okay. Answer will be B. Concerning the left phrenic nerve, select correct statement. Okay. Medial relation in both are identical. In both are identical? No. For sure it is not identical. Okay. They arise from C6, 7. No. I told you they arise from C3, C4 and C5. They supply the own side of diaphragm. Yes, they supply. Right will supply the right side of the diaphragm. Left will supply left side of the diaphragm. Option is C. Both phrenic gives off recurrent laryngeal. No, for sure wrong. Recurrent laryngeal given by vagus nerve. Next question. One of the following regarding right phrenic nerve is not true, because it should be here should find the false statement. Lies in superior mediastinum. Yes. It has superior vena cava on its medial side. Yes, it's also true. It is posterior to thoracic duct. No, it is anterior to. Passes through caval opening in the diaphragm on its right side. Yes, caval opening means T8. Okay. So the option which is wrong will be option C. Okay. Now regarding vagus nerve in the thorax, choose incorrect statement. Okay. Right vagus, let's see from the B option. The right vagus is crossed by arch of esophagus. No. Yeah, sorry. We have to find incorrect statement, right? Incorrect. False statement. So right vagus, yes. Arch of esophagus. Yes, esophagus in the right side. So right vagus will cross the arch of esophagus. Yes, it's true. The left vagus crosses aortic arch. Yes, see, in the left side, left vagus is present. So it will cross the arch of aorta. Yes. In the superior mediastinum, the left vagus is crossed by left phrenic. Yes. In the superior mediastinum, it is crossed by left phrenic. This point important, very important. Left phrenic is crossing left vagus. Now, only wrong option is the right vagus descends in the superior mediastinum between right common carotid and right subclavian. No. In between trachea and esophagus. Just you can do this question by exclusion also. Okay. So the answer will be A. Concerning vagus nerve, see, concerning mark one correct statement. The right vagus nerve passes in front of root of the lung. Right vagus nerve passes in front of root of the lung. Yes, root of the lung. Yes, true. Okay, sorry. Okay, they are asking one correct statement. So vagus nerve, guys, here see, don't get confused. Vagus nerve always pass behind the root of the lung. Okay, vagus nerve, vagus nerve behind. So it will be wrong. The left vagus nerve passes behind the, see, this is the true statement. Left vagus passes behind the root of the lung. See, the right vagus nerve passes on the anterior surface of esophagus. Absolutely false. The left vagus nerve passes on the posterior surface of esophagus. No, this is also wrong. So the right option will be B. Regarding thoracic part of sympathetic trunk, select a wrong answer. Let's see. It leaves the thorax by passing behind the medial arcuate ligament. Yes, it's true. The lower 5 ganglia gives postganglionic branches to the esophageal. No. Who gives? Upper 5. So this will be the wrong statement. Upper 5 ganglia. Okay. Now, the greater splanchnic nerve share in the formation of celiac plexus. Yes. It forms. It enters the thorax by passing in front of the neck of first rib. Yes, this is also true. So focus on A, C and D. It will be true. The wrong option will be B. Let's see. Let's talk about C. Greater splanchnic means it includes 5th to 9th, this total ganglion or thoracic nerves. Okay, 1 minute. Okay, lower or greater lower splanchnic means it should be from T9 to T10. Okay, so they are asking lesser splanchnic from T9 to T10. Okay, this you have to know. And lowest one will be lowest or least splanchnic will be either T11 or T12. Okay. Next question. Regarding thoracic part of sympathetic chain, choose the correct answer. It leaves thorax by passing behind lateral arcuate ligament. No, behind medial arcuate ligament. Okay. All branches are post-ganglionic. No, some branches are pre and some branches are post. Esophageal plexus receives sympathetic fiber from the upper 5 ganglion. See this question discussed before. This is the right answer. The pulmonary plexus receives sympathetic fibers from 3rd, 4th and 5th. No, it receives from 2nd, 3rd and 4th ganglia. Okay. Now the correct answer will be C. Regarding thoracic content, all are true except, let's see, all are true except, yes, arch of aorta lies, option B, see, arch of aorta lies completely in the superior mediastinum. Yes, it's true. The left recurrent laryngeal nerve curves around the arch of aorta. Yes, this is also true. The deep cardiac plexus lies near the bifurcation of trachea, enters the thorax by passing through the diaphragm. Yes, this is also true. So the wrong statement will be A. The thoracic duct passes with the esophagus through esophageal opening. No, thoracic duct, I have told you, thoracic duct in aortic opening at T12. Now, regarding thoracic duct, it commences at 3rd lumbar vertebra. No, at T12 lower border. Okay. It passes through the aortic opening of the diaphragm. Yes, I told you now itself. It lies on the right margin of the... No, for sure. If it is right margin, wrong answer. Because thoracic duct in left side. Right? It crosses from right to left at the 7th thoracic vertebra. No, at T5. Okay. Next question. Regarding esophagus, choose correct answer. Okay, it's clear, right? Until now, yeah. Esophagus is also a very important topic. Okay, it is constricted by right bronchus. No, which bronchus? It's constricted by left bronchus, which is long and narrow. You have to know about it. Long, so it constrict. It lies posterior to pericardium and left atrium. Yes, this is the correct option. Let's see other options. It passes through both superior and middle mediastinum. No, where superior and posterior mediastinum. Okay. It has arterial supply from the internal thoracic artery posterior to the trachea. No, it has, if you notice, it has arterial supply from descending thoracic aorta and bronchial artery. Okay. Esophagus blood supply. One of the statement is true concerning trachea. Okay. It lies anterior to esophagus in the superior mediastinum. Yes, it is true. Let's see other options. It begins at the level of the lower border of C6, no, C3, no, it is at the level of C6. The left primary principal bronchus is wider, no, right is wider. It consists of 16 to C-shaped complete ring, no, incomplete ring. See, it's like a tracheal ring is like this. This is cartilage, here membrane, okay. Next question, which of the following statement regarding the esophagus is true? They are asking true, okay. Begins at the level of teeth, C3, no, at the level of C6 lower border, okay. Same question as I discussed before. Passes posterior to descending aorta in superior mediastinum, no, it passes, talking about esophagus, yes, anterior. Pierces the diaphragm at the level of T12, no, at which level? T10. Remember, esophageal opening at the diaphragm is in which level? T10. And passes through the posterior mediastinum, yes, he is passing through posterior mediastinum. Let's see. Which of the following regarding thoracic duct is true? Okay. Begins at the level of body of T10? No, at the level of T12, where it is originating aortic opening. Just think about, see, if they ask esophagus ending, just think about esophageal opening. If they ask thoracic duct opening or thoracic duct origin, it is starting from abdomen as a cisternae chyli, and then in thorax it will be thoracic duct. Okay, so at which border? At the starting of aortic opening. So at T12. Okay, it receives left jugular and subclavian rim trunk. Yes, and also you should add, see here, add left bronchio mediastinal trunk. Okay, this is received by, yes, B should be the right answer. Passes in front of esophagus, no. Receives lymph from right side of the body, no, it receives lymph from left side of the body. Okay, here you can add one more concept here. Let me quickly recap. See, this is the tributary in abdomen, okay, in abdomen. It completely has three. Now we will talk about in, sorry, this, in abdomen it has, three, from intestinal lymph trunk, and it has right and left lumbar. Okay, so it will be total 3. And then in thorax, yes, here in the neck or root. Okay, this is in the root of the neck. Here in thorax it has posterior intercostal, okay, lymph and posterior mediastinal trunk. Okay, please, this will be for this question. Let's move to next question. Which of the following statement about course of thoracic part of esophagus is correct? It enters the posterior mediastinum anterior to aortic arch. No, enters a right posterior. See, it is related to right posterior to what? Aortic arch, right? Yes, we have studied in right posterior relation of arch of aorta. related to esophagus. It passes in front, right main principal bronchus and pericardium. No, it's also wrong. In front, for sure no, because we are talking about what? Esophagus. It enters the diaphragmatic opening at T8. No, esophageal opening at T10. It deviates anteriorly to the left as enters into the abdomen. Yes, so this will be the right answer. While esophagus course is going like to the left in the lower part and becoming stomach. Okay, so here this is right crus of diaphragm, left diaphragm. So here will be the opening at T10. Okay, here will be aortic and right side opening. Next question. Which of the following statement about the anatomy of esophagus is correct? Let's see. Has constriction at its beginning 17 centimeter from the upper incisor. See, 17 centimeter, or they can ask 7 inch. Okay, this is true. This is the answer. Let's see other options. It begins at the level of T6. No, it begins at the level of C6. Don't confuse here. Okay, C6. It crosses in front of descending aorta at the T10. No, it crosses behind the root of aorta at T7. Crossing of esophagus occurs at T7. Here, see, don't confuse. Crossing of thoracic duct occurs where? Occurs at T5. See, I have told you, relations, sides, very important in 104 or cardiopulmonary module. It is about 10 centimeter. No, see, in centimeter they are making mess. It is how many? 10 inch or 25 centimeter long esophagus. Okay, so this will be the wrong answer. This will be the wrong answer. Correct answer will be A. If you know the concept, it is easy. Just know about the constrictions where it is present at 7 inch from the upper incisor. One is there, and at the, let me just explain here shortly. Okay, see, at the 7 inch, we are talking about inch. Okay, 7 inch we have beginning constriction. Okay, at 9 inch we have due to arch of aorta constriction. Arch of aorta. 11 inch we have left pulmonary or bronchus. Left bronchus. I have told you, left bronchus. Yes. And 17 inch we have ND. Okay, which is related to diaphragm. Concept is clear, right? From this question can come. Now, the thoracic part of trachea is related posteriorly to esophagus within the nerve in between. See, thoracic part of trachea posteriorly. Which nerve, guys? I told you, sandwich. Yes, that is left recurrent. I told you. See, arch of aorta. From the vagus, it gives left recurrent laryngeal nerve, comes, hooks around below inferiorly and goes to sandwich in between two what? Trachea and esophagus. So, easy question. Let's see next question. Which of the following statement about the anatomy of esophagus is correct? Anatomy of esophagus is correct. Okay. It lies in the mediastinum anterior to the aortic arch. No, it is not lying anterior. Again and again, repeated question, guys, this one. Okay. Next, it crosses in front of descending aorta. Yes, at T7. I have told you. Yes. Position. It passes through diaphragmatic opening at level T8. No, at diaphragmatic opening at T10. It begins at the level of T4. Is it true? No, it is beginning at the level of C6. See, if you know, I have told you, if you know esophagus, beginning or origin, ending, and just you have to focus detailed anatomy. Anatomy means location, these kind of locations. Okay. One of the following regarding thoracic duct is false. Okay. Which one is false? Let's see. Commences at the 12th thoracic vertebrae. Yes, it's true. It's a continuation of cisternae chyli. This is the definition of the origin. Okay. Passes through the aortic opening. Yes, this is also thoracic duct is passing through aortic opening. This is also revision for you. Lies along the left margin of the esophagus in the superior mediastinum. Yes, thoracic duct means left side. So left margin. It's true. It drains lymph from right upper limb. No, right upper limb is drained through right lymphatic duct. Right lymphatic duct drain to right brachiocephalic vein. See, this will be the wrong answer. So the answer is D. Concerning trachea, let's see which is wrong. It is crossed anteriorly by left brachiocephalic vein. Concerning trachea, right? Yes. It is crossed anteriorly by left brachiocephalic vein. Yes. I have told you left brachiocephalic vein have long course to form, to come into right, yes, right side to form what? Superior vena cava. So it is crossing the trachea. Okay. Contains incomplete ring of cartilage. Yes, 16 to 20 C-shaped incomplete ring. Okay. Bifurcate at the level of sternal angle. Yes, that is also true. So the wrong statement will be D. It lies in the posterior mediastinum. No, it lies in the superior mediastinum. Okay. Now, concerning thoracic duct, mark the wrong answer. Okay, wrong answer. First thing, 45 centimeter in length. Yes, it's true. Emerges from cisternae chyli in the abdomen. Yes, it is also true. Enters the abdomen via esophageal orifice? No, it's entering through aortic opening. Again revision. Contains many valves. Contains many valves. Yes, it is also true because thoracic duct means it has lymph. Okay. Regarding thoracic duct, one statement is true. Let's see. This is a continuation of cisternae chyli at level T10. No. At level which level? T12. So this is wrong. We have to find out true statement. It transfers thorax in anterior, then in superior mediastinum. No. Thoracic duct at first in posterior mediastinum and then it reaches superior mediastinum. Simple. Okay. And then it opens at the beginning of left brachiocephalic. Yes, it opens. So it drains. It drains its lymph to left brachiocephalic. Yes, it's true. It receives lymph from the right side. No, it receives lymph from the left side. So this will be wrong answer. Okay, clear? Next question. Concerning thoracic lymph node, okay, all of the following are true except let's see. Parasternal lymph node drains deep part of the anterior mammary medial part. Yes, it's true. Brachiocephalic nodes lie along the left brachiocephalic vein in posterior mediastinum. No, it is lying in the along left brachiocephalic vein is true, but in superior mediastinum. Okay, here focus. Don't see left he is there. I will tick this option. No, this is wrong option. Read the option thoroughly, carefully. Okay. Diaphragmatic nodes lie on the diaphragm upper surface include 4 groups. Yes, it include 2 parasternal and mediastinal and brachiocephalic. Inferior tracheobronchial nodes lie below tracheal bifurcation in angle between both bronchi. Yes, it is also true. Tracheobronchial lymph nodes. So the wrong option will be B. Regarding bronchi, select the incorrect statement. Okay. We have to select the incorrect statement. The bronchial vessels lie behind the bronchi. Yes, bronchial vessels always lie behind the bronchi. Okay. Okay. Inhaled foreign bodies tend to enter the right bronchus. Yes. Why? If I ask why, because right bronchus is what? Wider and more in line with what? Trachea. So easily foreign body whatever inhaled directly pass to right bronchus. Now the right bronchus passes in front of superior vena cava. No, it is not passing in front of superior vena cava. Focus. Okay. Right bronchus divides into an upper lobe before entering the hilum of lung posteriorly to it most. Yes, this is true because it's already divided and entering the hilum. Okay. So the right answer will be C. They are asking incorrect. Okay, incorrect statement. So the odd one is C. One of the following statement is correct regarding the trachea. Regarding trachea. So it begins at the level of lower border fluid. Yes, it is correct. So the answer will be A. But let's see other options. Thoracic part lies in the posterior mediastinum. No, it is lying in the, which we are talking about, trachea. So it is lying in the superior mediastinum. Yes. It divides at the level of 6th thoracic vertebra. No. At which level? Sternal angle. I will not write again and again sternal angle. Disc between T4 and T5. Remember. An inhaled foreign body passes usually to the left bronchus. No. Wrong answer. It always try to pass in right bronchus. Okay. Choose the incorrect statement regarding trachea. Okay. It has 16 to 20 C-shaped ring. Yes. It ends in the level of 3rd thoracic vertebra. No, again disc between. Okay. So this will be the wrong answer. It related posterior to esophagus. Yes. It's crossed by arch of aorta. Yes. So the answer will be B. One of the following statement is wrong concerning trachea. Okay. Let's see. It lies anterior to the esophagus in the superior mediastinum. Yes, it's correct. In the deep inspiration, the carina may descend as far as the level of T6. Yes, this is also correct because while we inspire deeply, carina is depressing little bit. The left principal bronchus is wider. See, this is the very wrong answer. We already know who is wider. Right. Right is wider. C will be the wrong answer. Arch of aorta lies on its anterior and left side in the superior mediastinum. Yes, it's true. So the wrong answer will be C. Now, regarding thoracic duct, correct answer. Okay. It enters the thorax through esophageal opening. Is it? No, it enters in aortic opening at the level T12. It measures about 55 centimeter. No, it measures about 45 centimeter. This is the revision for you. It ends in cisterna chyli. No, see, by hearing cisterna chyli, don't take this option. It is not ending. It is starting. Starts from cisterna chyli. Okay. It contains many valves. Yes, this will be the answer. Correct answer. See, they tried to confuse you guys. So, regarding the tracheobronchial tree, foreign body enters most commonly. Easiest option, right primary bronchus. Okay, because it is wider and what? More in line. Regarding left principal bronchus, one is incorrect. One is incorrect. So we have to find false. It is wider than, see, first option itself, wider than right and wrong. Is longer than the right principal bronchus? Yes, it is longer. Related posteriorly to descending aorta? Yes, it is. Divided into two lobar? Yes, because left lung has how many lobes? Two lobes. Think about it. So the answer which is wrong is A. Which of the following structures lies opposite to the bifurcation? Which will lie? Think about it. Think about it. Yes, deep cardiac plexus. Is it right? Yes. We are about to finish. Okay. Which of the following structure lies in the anterior mediastinum? Now we are going to start mediastinum. In mediastinum, contents of mediastinum is very important. Okay, you have to know, you have to memorize. Let's see. What all are the contents in anterior mediastinum? See, I have before itself I told anterior mediastinum has superior, inferior, means sternum has a connection. It has connection on sternum and pericardium. Sternopericardial ligament. Plus it has a small organ of lower part of which gland? Thymus gland. And it has some lymph vessels and 2 to 3 lymph nodes it has. Okay, so totally this is the content of anterior mediastinum. So the only convincing option is sternopericardial ligament. Trachea, no. No. Heart is present in middle mediastinum. Trachea is present in superior mediastinum. Esophagus is present in both superior and, tell me, posterior mediastinum. Yes. Pericardial sac, I have told you, heart and pericardial sac will lie in middle mediastinum. Now, next question. The most superficial structure in superior mediastinum is vagus nerve? No. Right subclavian artery? No. Thoracic duct? No. It is posterior structure. Superior vena cava is the only convincing option. Only venous. Venous, mostly it will be superficial. Okay. So D will be the answer, superiorly, because you should study about contents of superior mediastinum. If you know the contents of superior mediastinum, which will be the superior structure, you will know. Okay, it's easy. Now, the structure found in both superior and posterior mediastinum is, okay, which will be trachea? Is it? No, it ends in superior mediastinum. At the bifurcation it ends. Okay, descending thoracic aorta from the disc between, so from the imaginary line it is starting, so it is not present in what? Superior mediastinum. Phrenic nerves, that is also not present in both. They are asking superior and posterior mediastinum, so the only option will be esophagus. Okay, all the way from the above till below. Let's see. A 45-year-old woman present with a tumor. See, by seeing the length of the question, don't think it is tough. It is very easy. See, woman present with the tumor confined to the posterior mediastinum. Posterior mediastinum. This could result in the compression of which following structures? Let's see. See, they are telling posterior mediastinum. Just think about which structure is present in posterior mediastinum. Trachea? No. Descending thoracic aorta? Yes, maybe. Let's see. Arch of aorta? Only in superior mediastinum. Arch of azygous vein? Also not present in what? Posterior mediastinum. So the only option here, see how I did this question easily. Which is present in posterior mediastinum will be option B. Now, which mediastinum is thoracic part of trachea located? Simple and easy question. See, if I take a sagittal section, it will be like this. This is what? Imaginary line which divides superior mediastinum and inferior mediastinum. This inferior mediastinum divided into anterior, middle and posterior. Okay, so here who is present? Trachea is present. Okay, superior. Imaginary line means what? It is the same disc between, see here also disc between T4 and T5. Okay. In the superior mediastinum, select the true statements. They want true statements. The azygous vein arches below the right main bronchus. No, below. It's not below. Above. Azygous vein arcs above the right ventricle. Now, we have the right brachiocephalic vein lies in the tubal layer. No. Brachiocephalic vein, right? So, it will be in the vessel layer. Okay. It's not in the tubal layer. The trachea and esophagus crossed anteriorly by the arch of aorta. Yes. See, this is the true option. The superior vena cava receives the azygous vein at the level of right first costal. No, at the third costal cartilage. Superior vena cava. Okay. Let's see next question. Regarding superior mediastinum, select incorrect answer. Okay. Its anterior boundary is formed by manubrium sterni. Yes. The arch of aorta lies within it. Yes. It is separated from the inferior mediastinum by a plane through third costal cartilage. No, this plane is disc between T4 and T5. So this is the wrong answer. It contains thymus. Yes, this is also true. Now, regarding superior mediastinum, indicate wrong answer. Okay, you have to indicate wrong answer. It is bounded from behind the upper four thoracic vertebrae. Yes. It contains trachea. Yes. It contains thoracic duct. Yes. So it contains inferior hemiazygos. No. Inferior hemiazygos for sure it is not. Inferior hemiazygos in posterior mediastinum. This is the incorrect option. Choose the wrong statement regarding contents of superior mediastinum. Contents of superior mediastinum. See how I am solving this question. See, think about superior mediastinum. Think about this above. Okay, left brachiocephalic vein may be the option. They are talking wrong answer, right? Yes, left brachiocephalic in the superior mediastinum. Inferior vena cava. No. Arch of aorta. Yes. Esophagus in both superior and posterior. Okay. So the inferior vena cava will be the wrong statement. Now, concerning the contents of posterior mediastinum, choose the incorrect answer. Incorrect answer. Esophagus, yes, it is present in posterior. Thoracic duct, it is present in posterior. Azygous vein, yes, it is present in posterior. Now, only artery which is not present in posterior mediastinum will be internal thoracic artery. Now, one of the following structures is a content of middle mediastinum. The following structures will be content of middle mediastinum, which will be, is it descending there? No. Ascending aorta? Yes, maybe, because it is in the content of the heart. So, heart is present. Heart is present in middle mediastinum. So, ascending aorta should be the option. Let's see, thoracic duct? No, it is present in posterior. Esophagus? No, it is present in posterior and superior. So, answer will be B. Okay. One of the following structure is not present in thoracic cavity. Let's see which is not, which is false. Okay. Lungs? Yes. Cisterna chyli? No, it is present in abdomen. I told you, in abdomen, lymph vessel, cisterna chyli. After cisterna chyli, at the level of T12, it is continuous as thoracic duct. Okay. Heart in the thorax? Yes. Even small children can answer this question. Azygous vein in at the level of T12 lower border? Yes, true. So the false statement here is cisterna chyli. C. 58-year-old female admitted to the hospital, severe dyspnea. Severe dyspnea. Remember, severe dyspnea. So it is related to lungs. Also complained pain over the shoulder. See, which is that nerve that has same root value as shoulder? See, so it should have root value C3, C4 and C5. So just think about that nerve which has C3, C5. Just which one? Phrenic. So the answer will be phrenic. See, think. Okay. You can read every question. See, a radiograph examination revealed an aneurysm of aortic arch. Okay. Which of the following nerve was most likely affected? Will be the phrenic nerve. Now, which one of the following nerve gives motor innervation to the diaphragm? Just think about diaphragm. Motor means phrenic. Easiest question by the name itself. Name itself, we should know the answer. D. Now, on examination, an aneurysm revealed. Aneurysm of abdominal aorta at the aortic hiatus. See, aortic opening is there. Here we have esophagus vein. Here we have thoracic duct, esophagus vein, thoracic duct, and descending thoracic aorta. So this is for aorta. So if there is a abdominal aorta aneurysm, so this has bulging. Okay, let me change the color. So this has some bulging abdominal aorta. So which structure is affected? Just think about the neighboring structures. Okay, just think about neighboring structure. Who and all? Esophagus and thoracic duct. See, the option will be C. Option C. Simple and easy answer. Okay. Now, abdominal aorta passes through the diaphragm at which vertebral level? Easy question. Abdominal aorta T12. Option C. Now, esophageal opening is surrounded by, esophageal hiatus is surrounded by which ligament? It is not median arcuate ligament. It is the right crus of diaphragm. I have told you, if this is esophagus, this is stomach. Right crus all the way surrounds this, and it acts as a physiological sphincter of diaphragm, of the esophagus. Okay, esophagus. So B will be the answer. No. Okay. The following nerve pierces the cupula of diaphragm to reach the abdomen. Which pierces the cupula? I have told you before, left phrenic nerve will pierce, okay, the left cupula. But right will go in which orifice? Vena cava, inferior vena cava opening, which is at T8. Okay, here it will go through this orifice. So the answer will be B, piercing. The caval opening diaphragm lies at the level of T8. B will be the answer. Easiest. This is so easy questions. Let's see. Aortic opening in the diaphragm transmits what and all? Let's see. Esophagus, thoracic duct, and abdominal aorta or descending thoracic aorta. Sorry. Okay. So just think. Vagal? No. Esophageal branch? No. Thoracic duct? Yes. See? C will be the answer here. Now, next question and the last question, guys. One of the structure passing in the descending thoracic aorta through, see, again, esophagus, thoracic duct, and descending thoracic aorta. Here, which is present in aortic opening, which will be at T12. Esophagus? No. Phrenic? No. Right phrenic? No. Only esophagus. Esophagus will be formed. One important concept you have to remember here. Last, I will stop the session like in 2-3 minutes. Okay. One important concept you have to remember here about the openings. Okay. First, I will talk about inferior vena cava opening. Okay. Inferior vena cava opening, aortic opening, and esophageal opening. Okay, this is very important. Okay, this 100% sure question will be asked from this question. Okay, which all are the, at first, what is the site? Okay, at which inferior vena cava? At T8. This one aortic at T12, and esophageal will be at T10. But what all are the contents in this? Okay, let's see. IVC has, yes, IVC opening or vena cava opening has IVC by the name itself, and a right phrenic nerve plus lymphatics from the liver. Okay, 1, 2, 3. Next 3 structure here, aortic opening will be, as I discussed, esophagus vein, thoracic duct, plus we have what? Descending thoracic aorta. And here esophageal, we have by the name itself esophagus, 2 vagi plus esophageal branches of left gastric vessels. Okay, vessels. This is the concept you have to remember. I hope this session find you useful, and this was the complete wrap up of today's class, part 2. Okay. Okay. Take like 2 minutes break and we will back. Yeah, 2 minutes break and we will back with physio. Okay. Subscribe to Osium channel and see you in the next session. Bye bye.